Good morning, you're listening to 97.7 The Bolt, and this week on the Humboldt County Memorial Hospital Your Care, Our Mission show, I am joined by Michelle Sleiter, and we've got lots of things to talk about. We're going to recap 2015, and we're going to talk a little bit about 2016. Of course, they've got lots of great stuff that happened in 2015, right, Michelle?
That is correct, and our managers had an opportunity over the last couple of months to kind of reflect back on what went well and what we were able to accomplish over 2015, and so it was pretty exciting to sit around the room and hear everything, and so I'd like to just share some of that with all of you. So in regards to just your general human resources area, we were able to hire 46 new employees in 2015, and we had 27 employees that were recognized for years of service in those 5-year increments, so extremely exciting to have that many folks having been around for quite some time. In nutritional services, we were able to attend 6 wellness events in the community and continue to build on opportunities for nutrition wellness throughout the community. So with the assistance of our dietitian, we've been able to do more throughout the hospital and into businesses. So looking forward to more of that in the future as well. From the foundation, from the 2015 Founders event, we were able to purchase the bladder scanner that was wanted at that time. And have received quite a few bequests and donations for the year. So the foundation is very excited about the ability that they'll be able to provide for the hospital in 2016 as well. From our auxiliary standpoint, there are 430 members and growing, and we're always looking for new members from that perspective. Throughout 2015, they were able to donate money for new uniforms for our EMT staff, provide some oxygen tank holders, do a chest-to-chest training tool that helps throughout the training process, recliner in long-term care, and then a laser for radiology for more effective placement. In our EMS department, we hit an exciting record, which was over 800 runs for 2015. And then also the mobile mapping was included, which allows our EMS staff to get to a location a little bit quicker by utilizing the technology that they have within the ambulance services. In our rehab department, we continue to see significant growth. We have great therapists, whether it's physical therapy, occupational therapy, speech therapy, and our massage therapists. They're doing wonderful things and really starting to make a difference for folks, and added 4 new employees just to that department alone. Our lab department, very proud to say that they had 0 deficiencies and 0 recommendations in their last CLIA inspection. So huge reward for those folks with how hard they're working within that department. In our dietary area, they were able to get new flooring, which is something that has been needed for a while, so much better support for our staff as they're standing all day. Also, we added a chef on staff, so we're able to start to see different menu items and a lot of excitement in regards to what he can provide. And now all of our dietary staff are CPR trained. That's not something they were in the past, but the fact that they work with individuals in the kitchen, we want them to be prepared for the worst case scenario. So they are now trained in CPR. From public health, we were excited to be able to provide flu shots during school conferences. That was a great success, and we look forward to doing that more as well. And then also providing health promotion visits after hospitalization. So those folks that end up in our hospital, unfortunately, public health is starting to work with them in their homes and make sure they have everything they need, understand what their health condition is, and then help them navigate their future to assure that we can keep them out of the hospital and keep them healthy. So that's working extremely well. And then we have 2 staff trained on smoking cessation. So in 2016, we look forward to providing some smoking cessation programs throughout the community to help those that are interested in making that change.
All right, awesome. Lots of things going on, and I'm sure there's plenty more to get to, but we're going to take a quick break here at 97.7 Bolt, and we will be back with Michelle to talk more about everything happening with the Humboldt County Memorial Hospital here on the Your Care, Our Mission show.
You're invited to the 13th Annual Founders Event, January 16th, at the Humboldt County Event Center. The night of 1,000 laughs will be a high-energy show with all the antics expected from dueling piano shows. With a minimum donation of $100, you will receive an invitation and 2 admission tickets. Social hour begins at 7, serving heavy appetizers with a cash bar. This fundraiser supports the purchase of a 3D mammography machine. Don't miss this incredible event at the one night of 1,000 laughs. Tickets are available by calling Gary Moritz at Humboldt County Memorial Hospital at 515-332-4200.
All right, we're back here on 97.7 The Bolt with Michelle from the Humboldt County Memorial Hospital, and this is the Your Care, Our Mission show. We're talking about everything that happened in 2015, all of the great things and all of the great additions that they had to the hospital, and so we were just talking about some of the things, and I'll let her continue.
Great. So in regards to infusions, we have increased utilization and just knowledge that we are able to provide infusions here in Humboldt in our hospital. Even though a lot of those services and doctor's visits are elsewhere, they can come back here to maintain that maintenance medication if they so desire. In our emergency room, we have private rooms now, so those that have utilized our ER in the past, there was a curtain separating 2 rooms, which didn't allow for a lot of privacy. And so our maintenance department was able to separate those rooms and make them private, which has added a lot of benefit to our staff and patients. We also now have EMS staff on site at night and on the weekends to support our nurses. Previously, we had 1 nurse on staff and then the nurses that would help from the inpatient unit. But if we had more than 1 patient, it got to be a challenge. And so to provide that security and safety for our patients, we decided to add EMS staff to there. So there are EMTs around to support those patients and to support those nurses and physicians throughout the night and weekend. And then we're trying to improve our entrance and awareness for ER patients. We've heard from a lot of community members that it's hard to find our ER, and I would agree completely. So we've added some signage. We've added some signage on the ground and just continuing to look at what we could do differently because we know that is an issue. In the outpatient clinic, we're excited to have a few new doctors with us. That started in 2015. So from Iowa Heart, we have Dr. Justice that has joined us. We have the Webster County Family Planning with Dr. Kelly Wallace. Dr. Paradapa is an orthopedic surgeon who has joined. Dr. Uden, who does telehealth medicine from a mental health perspective. And then Dr. Karim with neurology. So the huge growth in that area and excitement for our patients to receive care right here in Humboldt. And then Dr. Donchev, the general surgeon, will be joining us here hopefully this month. We've been working through the electronic health record pieces for him to get him up and running. So we should have a general surgeon with us weekly here in the very near future. In our independent living and assisted living areas, we have now full-time managers in each of those areas to allow more flexibility and patient services for those residents and tenants living there. In independent living, we've added a guest suite, so anybody that has a family member living there and is traveling in to stay with them, they can rent our guest suite for the week, and so they don't have to be across the street at a hotel or find somewhere else to stay. They can stay right there with our folks. And then therapy has increased their involvement with our patients in those 2 departments, in independent living and assisted living, and that's just to support any decreased mobility that they might have and to improve that mobility as well as reduce falls that they may see. So excited to have them as part of those teams as well. In cardiopulmonary, we were able to be recognized nationally during Cardiac Rehab Week for the activities that group provides. So 3 great individuals in that department that are truly looking to do more for those folks that have to go through cardiac rehab. And also proud to say that we had 100% cardiac rehab graduation rate,
awesome.
Which is wonderful. So a great service that we're able to provide right here in Humboldt. And then in radiology, we added the diagnostic mammo services. So we have a radiologist on staff weekly to do those breast ultrasounds and breast biopsies. So a huge asset to keep folks here right in Humboldt. And obviously there's a lot of other departments in our hospital that I haven't mentioned, but everybody makes it happen, just from the maintenance department to long-term care to the business office. A lot of great things going on at the hospital.
Of course, lots of great things that happened in 2015 and 2016 I have a feeling is going to be just as great, if not better. And one thing to help you guys get 2016 kicked off is the Founders Ball coming up this weekend.
Absolutely, and we're excited around the hospital knowing that's on Saturday. There are still tickets available for both our afternoon and the evening show. We are filling quickly, which is exciting for us, but if you haven't gotten tickets or have interest in this event, please reach out to Gary Mortz at the hospital at 332-4200. He'll be happy to walk through it with you. But again, still tickets available. We're really excited to have those dueling pianos back.
All right, awesome. Is there anything else that you would like to mention, Michelle?
You know, just to keep people informed, Medicaid managed care has been a hot topic with our state, and if you haven't heard, it was delayed until March 1st, and so people with Medicaid do have time to still navigate that new system as it switches from the state-run program over to 3 outside entities. And so please, if you have any questions, you can reach out to our hospital. Just to make everybody aware, we do intend to sign all 3 contracts out there. We have not done that yet. We're still negotiating with those contracts and those folks, but we will have that ready by March 1st for folks to know that they can continue to receive services through our hospital. And then, as you mentioned, in 2016, there is a lot of things coming. You know, an exciting one is our Diabetic Education Center. Dr. Ryan and Megan Wood will be joining our team, and Megan is an endocrinologist, so a lot of focus on thyroid, diabetes, adrenal, pituitary issues. And so we want to be able to keep patients right here to have that diabetic education, especially after seeing her. So our program is underway. We have 1 patient going through the process to assure that we receive the right accreditation and credentialing to move forward. So exciting to have that open in 2016 as well.
All right, awesome. So again, that is Michelle from the Humboldt County Memorial Hospital here on the Your Care, Our Mission show on 97.7 Bolt. Thank you for joining me this morning.
Yeah, thank you.